And I'd like to introduce Kara Burton as our Vice Chair and Executive Director of the Eastern Shore Public Library System. I'd like to welcome all attendees who have joined us via the internet and via the phone. I'm looking, we've about 46 people out there that have joined us. I will say this is exciting, but yet at the same time scary as can be, because this has never happened before. And so this will be, so there's absolutely no wrong way to do this today. So that's the good news. I will say that I am coming to you from my downtown Bellhaven studio, and I hope that the lights are good and you can hear me just fine. We will dispense with our usual custom of having all of our partners introduce themselves so we can get right to our featured community conversation. If you would like to leave your name in the Q&A box, that way we can mark you as attending. And it's important for our members to go in to the Q&A and put your name in there so we know you're here. And for our guests, first of all, thank you for being here, but we'd also love to know that you're here. So if you went into the Q&A box as well and gave us your name and email, that would be great, and we'll add you to our mailing. In this meeting, all attendees are going to be muted, and you won't have a camera. Your participation in the meeting will be via the Q&A box. Our panelists, who I will introduce in a moment, both have a microphone and a camera, which will be turned on as they respond to our question. So let us move on to the first item, and that is we would usually approve the minutes, but for today, and for the sake of brevity, we'll dispense with that. Just as an FYI, at our last meeting in February, focused on the annual report and acknowledging partners for their accomplishments. The major action that was taken was voting Kara Burton and myself into office as chair and vice chair. And I understand, Kara, that it's too late for us to have another vote at this particular meeting, so we'll dispense with that and move right on. Another, the agenda item for action is the diversity statement vote. I want to call on Andre Elliott. Andre is the executive director of our Eastern Shore Family YMCA and chair of our new Diversity, Equity, and Inclusion Work Group. This group has adopted a rationale for their work, which we'd like him to read. And today, as their first work product, Andre will make a motion of approval for the Eastern Shore Healthy Communities Diversity Statement. Just as an FYI, the executive committee has approved moving forward this statement, and now we bring it to the full coalition for a vote. Andre, I turn it over to you.
Thanks, Dr. Schaefer. Can you all hear me well? Yes, okay. So first I'm going to start with reading our rationale for having a diversity, equity, and inclusion work group within Eastern Shore Healthy Communities. Our community is nourished and strengthened by diversity of its residents. Eastern Shore Healthy Communities believes that to strengthen and nourish our partnership and its ability to work towards well-being for all Eastern Shore Virginia residents, we must intentionally recruit partners to reflect the diversity of residents within our community. This conscientious act of inclusion will provide a diversity, will provide a diversity of voices and perspectives to our consideration and action to promote the well-being. This diversity of our partnership will also provide a better perspective on issues of equity or what is needed to provide equitable opportunity for well-being throughout our communities. Further, we believe that our vision of Eastern Shore Virginia well-being requires a special focus on diversity, equity, and inclusion. To that end, we have appointed a special work group to raise awareness of issues unique to certain race, ethnicities, cultures, genders, people with unique sexual identities, those with disabilities, and financial challenges. This work group has accepted the responsibility to study these matters, create a diversity statement for the coalition, and develop a strategic approach regarding diversity, equity, and inclusion for our 2021 to 2023 strategic plan. Further, this group will inform and advise our executive committee on such matters and assist and advise other ESHC work groups as diversity, equity, and inclusion infuses all topics on which ESHC works. Eastern Shore Healthy Communities as a partnership and as a member organizations and individuals accept the responsibility to serve as role models to our community for diversity, equity, and inclusion. Our intentional actions in this regard align with our mission, vision, values, and framework. We intend for our actions to serve as a model for communities, educational institutions, employer organizations, and other social groups, and we will actively work for our community organizations and institutions to adopt similar diversity, equity, and inclusion policies and practices. Finally, because each of us is unique in our traditions, customs, and lifestyles, we must not presume that we know the life experience of others. For this reason, we will intentionally practice cultural humility, a process of reflection to gain a deeper understanding of cultural differences. With cultural humility, we intend to improve the way vulnerable groups are treated and understood. We recognize that the more we are exposed to cultural differences from our own, we will come to realize how much we don't know about others. Our intention to practice cultural humility will require constantly challenging ourselves, continuously learning, and critical self-reflection. Recognizing and influencing power imbalances and remaining an accountable partnership and encouraging others to do so as well. So that was the rationale for having a diversity, equity, and inclusion work group. And I'd like to make a motion that we pass the following diversity statement, adopt the following diversity statement as a diversity statement for Eastern Shore Healthy Communities.
I'd like to
So the
second.
statement again. Okay. The mission of the Eastern Shore Healthy Communities is to create a healthier Eastern Shore. Eastern Shore Healthy Communities recognizes that in order to accomplish this mission, our initiatives must take into account the needs of diverse communities in which we serve. We will strive to affect policy, systems, and environmental change that supports our commitment to the health and well-being of our community. Excuse me. Goodness, y'all. Sorry, I started that wrong, Patty. My apologies. Let me go back. Eastern Shore Healthy Communities envisions all residents reporting a growing positive sense of health, well-being, and self-empowerment. It is to develop an accountable community using policy systems and environmental change strategies to improve the health and success of the Eastern Shore of Virginia. We believe that our partnership, as well as our community, is nourished and strengthened by the diversity of our residents. Therefore, we commit to having a partnership that is reflective of our diverse community. Our partnership values equity, believing that all persons have the right to full and equal access to opportunities that enable them to be healthy and enjoy well-being. We intend to improve the way that vulnerable groups are treated and understood. To do this, we will challenge ourselves to continuously learn and self-reflect, recognize and influence power imbalances, and remain accountable to our mission, vision, and values, especially with regard to diversity, equity, and inclusion. We intend for our actions to serve as a model for communities, educational institutions, employer organizations, and social groups, and we will actively work for our community organizations and institutions to adopt similar diversity, equity, and inclusion policies and practices. So that is the diversity statement.
Do I have a second?
I second. Sorry, they remuted me. Yes, I second it. I can't hear Dr. Schaefer.
Sorry about that. Given the unique nature of this, we do have a motion and a second. We'll dispense with discussion and move right to the vote. Now listen carefully in terms of how you will vote. If you are an Eastern Shore Healthy Community Partner, and if you disagree with the proposal, please go into the Q&A box and write, I disagree. Again, go to the Q&A box and write, I disagree. Have we received any I disagrees? Seeing none, this motion passes. Before we go on to agenda item number 4, Andre, I want to thank you and I want to thank your work group for this important work on this issue. From my vantage point, it was extremely thoughtful, and so pleased we're moving forward on it. Thank you.
Thank you, and it was our pleasure.
So now let's move on to our community conversation, the reason we're here today. If you don't know me, I have been on the shore since July 1, when I took over the presidency of Eastern Shore Community College. And in the short time that I have been on the shore, I cannot tell you how impressed I have been and continue to be with the giving nature of people on the Eastern Shore. I've seen it every day. And I've seen it in our first responders and their willingness to be where they need to be as quickly as they can. I've seen it in faculty and students who have taken on this challenge of doing homeschooling by parents, or whether it's delivering things in a remote fashion. And I also know, in talking to my friends and neighbors, that staying home has been not easy. And I'll speak for myself. I go stir crazy. And I also know there's a personal cost involved with this. And I must say, I know people are making sacrifices because they love the Eastern Shore and they're dedicated to their community. Now, I know we are human, and by being human, we can be strong, but yet we experience stress. And each of us is going to feel stress at this point in time in different ways. Last week, the Eastern Shore Healthy Communities led a celebration of Resilience Week in Virginia. And if you didn't get a chance to read what Patty had put together in terms of resilience, the 6 items related to that, Patty, it was absolutely wonderful. And as a matter of fact, I used much of what you wrote to communicate with my staff at Eastern Shore Community College. What Patty led us through was that we had 6 keys to resiliency. And what I'll say before that is resilience isn't necessarily what you may have in front of you now, but resilience is something that you can learn. The 6 keys to resilience are: first, we must take care of ourselves. And keep in mind, taking care of yourself isn't selfish. It's merely essential. We must require healthy, supportive relationships. And I love Patty because she uses great songs to enforce that. Bill Withers, We All Need Somebody to Lean On To, and of course, Bette Midler, You've Got to Have Friends. We have to have healthy friendships and good mentors. It's life-saving. And remember, you need to be and think flexible. We need to deal with change. We need to stay calm. We can't get stuck and remain inflexible. If there's one thing I have learned during this crisis, is to be flexible. We need to think positive, which means we have to accentuate the positive and try to eliminate the negative. Let me put a song in your head for the rest of the day. Bobby McFerrin in the 80s said, "Don't worry, be happy." Another one will be a bumper sticker that you have seen that says, "Less barking and more tail wagging." We also need to actively cope with stress. Stop denying that you're stressed. Start accepting that you're stressed, know what that feeling is, and find ways to deal with it. And then finally, discover our purpose, our moral compass. What I like to think of, finding what is your true north. And by finding your true north, what will happen is you'll channel it into helping others and develop and live by your principles. As I said at the beginning, some people are born, have inward resilience, but others maybe not so much. But at the end of the day, anyone can learn resilience from the principles that I've just gone over. I encourage everyone to practice their resilience and encourage our panelists, and let me repeat this, I'm encouraging our panelists to tie their responses to one of the resilience keys so that our audience gives them something to practice when they leave here. This past week, we've had the good fortune of Minister Karen Downey bring to our attention the need for this forum. Minister Downey, we thank you very much for that. She said, called our attention to, that our community members have questions and they need support at this time during the COVID-19 crisis. So we immediately decided at our executive committee meeting to move this quarterly meeting and determine that it would be devoted to addressing the many questions that she raised, as well as others that will be raised at this meeting. We want to create an environment of information support and resilience in this time of crisis. So let's begin this community conversation, and might I add, the first of its kind in this format, by introducing our resource panel from our community who will help us make sense of some of the things that have us worried during the crisis. Our health panelists are Dr. Richard Williams, Medical Director of the Eastern Shore Health District, Dr. Tom Hollinsworth, Medical Director of the Eastern Shore Rural Health System, and Christy Trumbo, a licensed professional counselor and owner of the mental health counseling practice, Capture Your Own. We have our social services panelists, Mozilla Francis, Director of the Northampton County Social Services Department, April Graham, Benefit Supervisor for Accomack County Social Services Department, and my friend Charmin Horton, with the Manager of Food Bank of Southeastern Virginia and the Eastern Shore. And then our faith community panelists. We have Reverend Alex Joyner, District Superintendent of Eastern Shore's United Methodist Churches. And Alex was one of the first people to reach out to me when I came here. Thank you, Alex. And also Minister Karen Downey, Assistant Minister of Jerusalem Baptist Church. Now let me set the ground rules. We want this to be a good discussion, and we hope that while we are addressing some of the questions that you sent ahead, we hope that you will write down questions that you may have in the Q&A box that's on the right hand of your screen. We'll do everything possible to address as many questions as we can in the time that we have. You should know that we will be recording, matter of fact, we are recording this meeting today, and we'll post it to our website, which is eshealthycommunities.org. That way, people who couldn't join us today, we can send them over here so they can see this. I will turn over facilitation of the Q&A period to Patty Kiger, our most capable Executive Director of Eastern Shore Healthy Communities and Instructor of Pediatric Community Health and Research at Eastern Virginia Medical School. But before I do, I must, and I hope you will join me in thanking the Eastern Virginia Medical School for having served as the Eastern Shore Healthy Communities lead agency for well over 10 years. I would also like to acknowledge the team behind the cameras that you can't see, the EVMS technical support professionals who are behind the scenes as we speak, making sure that this meeting goes smoothly, and I understand they're providing all the need that I have so that my wrinkles are not showing through during this time. Alex, just kidding. So they have spent the last week coaching and guiding us, and Lord knows they've been patient with me. We are most grateful for their support and dedication. And so with that, I want to turn it over to our Executive Director, Patty Kiger.
I can't hear Patty. She's muted.
Can you hear me now? Okay. Thank you, Dr. Schaefer, and welcome panelists, and welcome to all of our participants today. The count on those who are viewing us or phoning in with us is up to 72, and those of you who've been with Eastern Shore Healthy Communities knows that's a pretty record day. If you are not already an Eastern Shore Healthy Communities partner, please know we would love to have you join us. And if you put your email in the Q&A box, I'll add you to our mailing list. Our 6 work groups are hard at work on our strategic plan, and we can always use more partners to work towards our vision of creating a growing and positive sense of health, empowerment, and well-being on the Eastern Shore. We have questions that were submitted in advance. I will ask those first and call on the appropriate panelists. Meeting participants, if you are online and have questions, please type them in the Q&A box on the right-hand side of your screen. If you see that someone has already asked the question, or you see that someone is asking a question, if you look in the Q&A box, there is a place where you can click on like, and you can like that question rather than repeating the question again. If we don't get to all the questions before 4:30, we'll certainly get a response for you, and we'll post those responses on the website. So panelists, when I refer a question to you, please unmute yourself, respond to the question, then remute your line. We have lots of questions, so be as thorough as you can, knowing that we have other questions. And if you're comfortable and can segue into a resilience key in your response, we would appreciate that, because it's good to have good information, and maybe even more important for us all to build our resiliency skills during this time. So let's begin. We'll direct our first questions to our health professionals, and I'd like to call on Christy Trumbo, our mental health professional. Christy, there are 3 questions I think we can ask all together and you can respond to. So here's what person number 1 wrote in. I'm scared. I can't go anywhere. I'm afraid of this virus. And then the second comment from another person was, I've never experienced anything like this. I don't know how to handle it. And a third person said, all of this talk about the virus is making me anxious and depressed. I'm overeating to cope. I like that. I know that's not healthy. I just don't know how to deal with this anxiety and depression. Christy, can you help us?
Absolutely. And thank you, Patty, for having me. One of the most important things to remember at this time is the old cliche of you are not alone. And the minute we can say, I don't want to panic, we've actually already started panicking. So the beauty of it is we are all depressed, and that is what's expected. We are being asked to do things that are not normal. We're being asked to do things that are not comfortable. We are human beings who require relationships and partnerships and communication and touch and hug. Although there are a lot of introverts who are singing their praises that the world has finally come to enjoying their lifestyle, more so we have people who are afraid. I'm seeing everything from 12-year-olds all the way up to 60-year-olds who are saying, I'm afraid of what might happen. Fear is good. Fear is never a bad thing. When we lose sight of how fear can benefit us, that's where we're going to run into trouble. So looking at the 6 keys to resiliency, first and foremost, let's actively cope with the stress. Let's look at what we can manage, what we don't have to manage, and how we can take care of ourselves through there. So you're actually looking at all 6 keys to resiliency. First and foremost, there are things that we cannot control, let alone manage. We have guidelines. We have government officials who are telling us what to do. We have newscasters who are instilling panic in us. So what we have to do is come together. Call people, talk to people, check on each other, wear your mask, and live in a way that you are protecting yourself. As it was stated earlier, that's not being selfish. So let's start with, you've got 6 great keys, and if you actively go through those, you are actively coping with the stress.
Thank you. Thank you very much, Christy Trumbo. For this next question, I'd like to call on Dr. Richard Williams, who is our medical director for the Eastern Shore Health District. One person wrote to us and said, I work at one of the poultry plants and contracted the virus. They sent me home to be in quarantine, to isolate for the next 14 days. We have 3 families living in our home. How do I keep everyone else safe? Dr. Williams?
Thanks, Patty, and good afternoon, everyone. Yeah, this is a situation that we see again and again with our poultry plant workers, and this is one of the things that's caused us in the health department great concern. The poultry plant workforce is largely African American, Haitian Creole, and Hispanic. And a lot of the folks live in homes where there are multiple folks and even multiple families in a very small place. And as we all know, the poultry plants and all meat packing plants across the nation have demonstrated themselves to be extraordinarily efficient venues for virus transmission. So the household contacts of folks with COVID-19 are by definition close contacts. It is very, very difficult for any household contact living in the same household to even in a larger place, you're going to still cross paths. It's very, very difficult to avoid exposure, significant exposure in that paradigm. So this is, and in the smaller venues, it's an even greater challenge. The poultry plants up and down the Delmarva Peninsula, some of them have developed a strategy to try to help workers by renting hotel rooms where poultry plant workers who have tested positive can stay. That is an option for some folks, but for others, it's not, because folks want to stay with their family. From a medical perspective, when you're in that situation, you just want to stay if you're the person with the disease. And thankfully, with this disease, many folks will have only a minimal expression of symptoms, and some folks will have no symptoms at all. Just stay away, as far away physically as you can from your family members. A good strategy is, if you're going to be in the presence of your family members, stay closer than 6 or 8 feet away. You can wear a mask. That does control to some extent the amount of virus that you actually shed into the environment. But it's a very, very great challenge. We have, in the health department, we have reinstituted a containment, or we are reinstituting a containment strategy called contact tracing. The way that works is, for every person that actually has the disease, we develop a list from talking to them of their close contacts. And for everybody's information, that's anybody who has been within 6 feet of the person with the disease for more than 10 minutes. And we call those folks, and the person with the disease goes into isolation, and the others go into quarantine. So what we're doing is reinstituting our quarantine close contact tracing in order to maintain telephone contact with family members, especially of the poultry workers. The populations, the folks that work in those plants, ethnically have been at great risk nationally for this disease. And in recognizing that, we're trying to maintain contact with them, to talk to them every 3 days at the very least. If they do develop symptoms, we can help advise them on how to get medical care, and we just stay with them and keep up with them. So it's a difficult situation. I think the resiliency skills to this applicable are, of course, take care of yourself and actively cope with strategies to reduce the transmission of the disease with masking and distance as much as you can. Thank you, Patty.
Thank you, Dr. Williams. It's a lot to remember. My next question is for Dr. Tom Hollingsworth. I know this is a question from one of our people who sent in a question ahead of time, and that person said, I know I had all the coronavirus symptoms, but they wouldn't give me the test. I mean, what am I supposed to do? And why won't they give me the test? Don't I deserve one too?
Thank you, Patty. Good afternoon, everybody. And please know that doctors feel your pain. I mean, from the beginning of this whole pandemic, um, testing has been a huge source of anxiety, frustration, confusion, and that's just talking about providers. And I can imagine for patients that the constant changing and conflicting information that people get from news, from their providers, and sometimes from social media, and when patients are just trying to stay healthy, can be incredibly frustrating. So please know that we feel your pain. The consensus among every provider is that testing is essential. We know it helps with identifying cases, predicting the course of the disease, controlling the spread of the disease, and every provider on the shore wishes that anyone that wanted a test could get a test. I'll give you just a little history of testing on the shore for the past few months. So when this first hit, there were a very limited number of tests available through Virginia Department of Health or the health department, and there had to be some very strict parameters on who could be tested. The VDH are excellent stewards of resources at the state level and at the local level, and they have to make some tough decisions about what would benefit a whole community the most. Riverside Health System and Eastern Shore Rural Health partnered with the health department to identify and test the highest risk cases to try to get a handle on this at a very early stage. Very soon, we had availability of testing through the commercial lab. So LabCorp made it available for us to be able to do the same test, but actually send it to a private lab. That was a big breakthrough that allowed us to test some people that really didn't meet the strict criteria that was required by the health department. But unfortunately, very quickly, the commercial lab was overwhelmed. We were looking at a 8 to 10 days, sometimes longer turnaround for the test results to come back, which obviously is not helpful for the person that we're testing, but can be helpful in tracking cases. The lab was doing their hardest. They were working their hardest. They were going 24/7, doing their best to keep up with demand. But at that time, it just wasn't available. And so meanwhile, we're seeing on the news, we're seeing that across the Bay, there's drive-through clinics that are being advertised. Anybody can come by and get a test. But actually, if you look into that, these were still symptom-based clinics. So if someone drove through, if you're feeling well, didn't have any exposures, it wasn't as if people were just getting a test. They were still asking questions. They were still looking at risk. And even in people that had symptoms, but they weren't in a high-risk group, they were still being told to go home and quarantine or isolate. And the people that were tested, they very soon ran into the same 10-day turnaround problem that we had. So these drive-through clinics, even though it seemed like there was a big difference between what was going on across the Bay and what was going on the shore, it really was kind of the same approach that Eastern Shore doctors were taking, and they had pretty similar availability to these tests that we did. So for this person that's writing in, it seems very frustrating that the symptoms seem very typical, but there's no test available. But clinical diagnosis, especially early in the course of this, was very common. So if a person really was not at high risk for decompensation or having worsening of this disease, if a person has symptoms, it's endemic in the community, it's following the typical course, whether the test is positive or not, the person has it. And so the health department and also physicians are going to still recommend the same quarantining. So it can be frustrating not to have the yes or no answer, but there are problems with the test. And so if clinically a person has COVID-19, then we're treating them as if they have COVID-19. So testing, again, was a scarce resource. We needed to establish, where it can do the most good. So initially, critically ill patients that were admitted to the hospital, where knowing the status was very important in knowing what the clinical course was going to be, and also in protecting healthcare workers, making sure that we weren't spreading this to other people in the hospital. That was obviously the very first priority. Also, healthcare workers. You certainly don't want a symptomatic healthcare worker that is taking care of well patients. Otherwise, we're going to see some very bad results from that. As soon as this was identified in poultry plant workers, our poultry plant workers were actually in a high priority population. And so there were hundreds of tests done at that point to help try to get a handle on that. Please know that I'm very optimistic, and I think that testing technology is going to progress pretty quickly, and I think we are going to have some more availability. Please know that medical groups on the shore are reviewing this every day. We're trying to keep up with this hard balance of availability versus demand, and make hard decisions based on science that's still evolving every day and still emerging as we speak. So, and just a little bit of a side note, you are starting to see some companies springing up that are offering tests that may not be of a good quality. There were some issues with there are a number of these tests that you're starting to see advertised with in-home tests, with antibody testing, self-administered things. Some of these may be okay, but a lot of these really, it's almost like flipping a coin. Information you get may be very suspect. So, there's a fire hose of information coming at us. Rely on your providers, rely on good, reputable sources, Virginia Department of Health website, CDC website. Those are great resources. And just do your best to try to arm yourself with the best information that you can.
Thank you, Dr. Hollingsworth. While we have you, keep staying unmuted. One of our partners offered this comment that she heard from a neighbor who said, I work in one of the poultry plants. I can't lose my job. I don't want anybody to know I'm sick because I need this job. So I'm just going in. Dr. Hollingsworth, what would you say to that neighbor?
Well, I think we understand there's a great need to work. People are hurting financially. There's a lot of uncertainty. There's a lot of financial pain people are feeling, and work feels normal. And that's as Christy said earlier, we are seeking any normalcy in this entire crazy time, and work feels normal. So staying at home for 10 days and possibly subjecting your family to an additional 14 days. It might feel more comfortable just to kind of ignore that, especially if your symptoms aren't particularly bad, which is the case in a lot of cases of COVID-19. So the tendency is to want to kind of ignore the symptoms and just go in. But we have to consider each other in these times. We have to know that we're all in this together, and more than ever, our decisions are going to impact other people to a really incredible degree. And the damage an infection can do to a coworker or a friend or a family member, if we're not being individually responsible to ourselves and being careful to contain this, can be huge. But also we can do harm to ourselves if we don't get the proper rest and recovery period. So it's we're taking care of each other, but also taking care of ourselves. I think I would tell the person that there are a number of emergency laws to protect workers from that have to take absences during this time. And so if I knew somebody that was considering still going in, even though they knew they were sick, I would ask them to contact their human resources department to review the options available to them. I think we have to be flexible. We have to empower ourselves with good information. We have to look at all the resources available to us, medical, counseling, but also legal aid services to help make good decisions and get through this crisis.
Thank you. And Dr. David Jones was unable to join us today, so if you don't mind, Dr. Hollingsworth, if I could come back to you with this next question. My husband had to have surgery and I couldn't even go into the hospital with him. I understand why, but I couldn't leave the parking lot until I knew he was okay. There was no place to even use the restroom. What do you say to all those people who have loved ones who are getting surgery and they can't go into the hospital?
That is tough, and that is, and I know that on the outpatient, I'm much more familiar with the outpatient realm, and I know it's been very confusing for people not to be able to come into the office to actually see their providers one-on-one. We're doing a lot more with telemedicine. I know that hospitals are doing their very best to maintain people's humanity and to, I think nurses are doing a lot extra to comfort family members. I think that there's a lot more options available for being able to connect with, video conferencing. I've read some great innovative things that they're doing. But again, this is one of those instances where we have to come together as a community and just realize we got to protect the most vulnerable among us, and those tend to be people in the hospital.
Thank you, Dr. Hollingsworth. We'll go back to Dr. Richard Williams for this next question. Dr. Williams, if you would unmute him, please. The question is, my brother's in jail. Is he going to get the virus?
Hey, thanks, Patty. We've, in the Virginia Department of Health, we've had a lot of experience with regard to not only COVID-19 outbreaks, not only in correctional facilities, but also in long-term care facilities, and obviously places like congregate settings like the poultry plants. With regard to the Department of Corrections facilities and local jails, they are facilities, because everybody's living together in close quarters. They are facilities that are at higher risk for developing outbreaks of COVID-19. We've worked extensively with the Department of Corrections to address outbreaks in several larger correctional facility venues across the state. I've got direct experience with one of those in the Three Rivers Health District. I can tell you that the Department of Corrections healthcare workers and their healthcare physicians and healthcare managers, all the way up to their central office and headquarters, take their responsibilities to take care of the folks in the prison as best they possibly can. They've done a robust planning with regard to staff, with regard to strategies to keep the virus from getting into the prisons and jails to begin with in the first place. They also have really ramped up their use of personal protective equipment inside the facilities. If there is an outbreak, they do aggressive testing of the entire of the area of the prison where the outbreak starts, and they expand that testing as needed throughout the facility. And based on the results of that testing, the attempt is to try to use that as a defensive strategy. So if there is an outbreak, they try to protect folks that are still negative by cohorting housing and where they're staying in a defensive fashion, so the negative folks hopefully stay negative. So, and like I said, they take it very, very seriously. So, and I might also say they consult not only with us in the Virginia Department of Health, but also with top level other medical authorities like Virginia Commonwealth University and University of Virginia, the medical school out at Virginia Tech, and so very conscientious. So in answer to the question, it is not by any means inevitable that if you're in jail, you'll get the virus. Every attempt is made to keep you from getting the virus. If you do get exposed and you're in a correctional facility, our experience thus far is that the folks that do get the virus in these facilities that go on to get serious illness that requires hospitalization, those numbers are relatively low. So that's a point in favor if you are in one of these facilities and do get the virus. And I can assure folks that from my experience and my direct observation, the folks in the jails and the prisons are making every effort to take care of folks and prevent spread of disease. Thanks, Patty.
Thank you, Dr. Williams. So for our next question, we're going to go to Christy Trumbo one more time. Someone let us know that they have a friend who is so depressed right now because of everything that's going on, and they say, I don't know how to help him. Is there a hotline somewhere we can call, or what should we do?
Absolutely. There's a hotline that's available all the time, either by phone call or a text, and Joel's going to put that up for us. The other thing I want to remind everyone is this is not a time to keep secrets. when there is someone who is so depressed or feeling very, very low and not sure what to do, remember to reach out. We have a great crisis intervention team through the hospital. We have many trained professionals with our law enforcement. But that's when we keep people talking and we encourage them to reach out for all the help they can get. Again, remembering the 6 keys to resiliency for yourself and helping them as well.
Thank you, Christy Trumbo. So we're going to move on to a few social services questions, and I'd like to ask the first question to April Graham with Accomack County Social Services Department. Someone tells us, I go to the grocery store and there's no food. Are they forgetting about us on the Eastern Shore? This is for April Graham.
Hi, thank you, Ms. Patty. Well, I can certainly appreciate that question and concern. Sometimes when you're going through a difficult time, it does feel like you're alone or even forgotten. But I assure you that the Eastern Shore has not been forgotten. Try to remain positive. Empty store shelves are not just here on the Eastern Shore. It's not a local issue. It's nationwide as well as worldwide. The grocery stores just can't keep up with the demand right now. And let us not forget the people who hoard. They get way more things than they need for now. So just know that we're all facing the same thing, and I urge you not to panic. Try to be resilient and optimistic as we flatten the curve and move to our new normal, because I believe it's going to be around for a little while. But these are the tips I want to give you for the grocery store. Be flexible, like perhaps substitute something that's there from what you had on your list originally, like pasta or rice or what have you. So be flexible even in your options. And think about yourself as well as others by buying only what you need now. And so it'll be available for other people to use too. You can always go back again. And my last thing I want to leave you with is, if you have a chance to ask a manager about the missing items or when they're going to be available, or even when their freight goes up, that might help you get the things that you need. Thank you, Ms. Patty.
Thank you, April. The next question we will pose to Mozilla Francis. Someone asks us, why are all the low-income people, essential people, being laid off? Plant workers, nursing assistants, services. I mean, I worked 2 jobs just to make ends meet, and I got laid off from both. Mozilla, how would you respond to that question? Questions for Mozilla Francis. Can we unmute her? Joel Hilton, can you unmute Mozilla?
Yes, ma'am. She is unmuted.
Okay. Okay, we can't hear her. Or see her. Joel, is she still there?
Yes, ma'am. She's still there. Let me work with her signal. If we can maybe come back to that question, I will work with her offline and see if we can get her signals back online and so we can see and hear. I apologize for the technical difficulties.
No problem. Charmin Horton, how about we go to you next? Oh, there she is. Hi, Mozilla. Are you, you're unmuted, but we can't hear you. So we're going to come back to you. We'll go to Charmin Horton next. And Charmin, here is your question. We rely on school meals to feed our family. They stopped. Will we have summer meals? So Charmin, could you tell us what we need to know about school meals and summer meals?
Yes, I can. Thank you, Patty, and good afternoon, everybody. We have actually been working, the food bank has been working with both Accomack and Northampton County school systems to ensure that there is not necessarily a gap in the meals provided for those children. We are, while we are not doing distribution of prepared meals, we have partnered with both school systems to increase the amount of access to non-perishable and other perishable food items for those families. That has been at the forefront of our minds ever since they closed school to begin with. Even before they stopped their food distribution or their meal distribution, we were there to provide additional food products to go home with those families. And we will continue to do so throughout the summer for as long as they're willing to partner with us, and as long as we're able to get there to give out those distributions. In addition to that, we have added additional neighborhood mobile pantry distributions to try to fill that gap as well. So we have added a mobile pantry in Northampton County. We have opened the one at the community college that is now open to the public and not just faculty and students at the community college. And we have one in Northern Accomack that and those two, the one in Northampton and the one in Northern Accomack, we're doing weekly to try to provide services to those families that we serve. Also, all of our partner agencies are still distributing food. I only have 2 agencies that have actually closed right now. So there is still, there's plenty of access to food products. And then if anybody has any questions, they can definitely call us at the food bank, and we'll be able to point them in the right direction. We know that transportation is a huge issue for a lot of the folks right now, and we are, so we're trying to be in the area as much as possible.
Sharman, would you give us the food bank phone number?
Sure, it is 757-787-2557, or our website is foodbankonline.org, and all of our normal partner agency distributions as well as our COVID-19 response distributions are listed on there.
Thank you, Sharman. Thank you, Sharman.
Thank you, Patty.
Okay, is Mozilla good? Mozilla, can I hear you? Okay.
I apologize, Patty. I think we're still having issues. Mrs. Francis, if you wouldn't mind to disconnect and reconnect, that's probably going to be the best way for you to reconnect with the meeting. I apologize for the technical difficulties we're having with you.
Okay, well, we will ask Mozilla to go offline and then come back online. And meanwhile, let's jump down to our panel of faith community leaders. Unfortunately, Reverend Jones was unable to join us, I believe. So, Reverend Joyner, could you, Alex Joyner, the district superintendent for United Methodist Churches on the Shore, I hope you don't mind me jumping in with this question. I lost my mother to COVID. We can't hold a service. This is a time that I need to mourn and to be with my friends, family, the people at my church. I just feel so sad. What kind of guidance and advice can you offer her, Reverend Joyner?
Yes.
Okay.
Can you hear me now?
Yeah.
Okay. Yeah. Thank you. It's great to be on this great panel. I'm just really impressed that we have all of these folks here working with the Eastern Shore community and the resources that we've got available. So thanks for having me on as well. That's a tough situation that you describe. It's in the midst of going through the experience of mourning and grief is something that's not normal and makes everything seem strange. And then on top of that, to have this pandemic just adds to that feeling of strangeness. So I would, and one of the things that we're used to doing when somebody has a loss is to go be with them, to fill the house with food, do all the things that we're used to doing. Unfortunately, during this time, I think folks who are going through that process have to be a little more proactive than they would have been otherwise, and to recognize that there are still folks out there who care and who want to express their connection with the person who's had the loss, but are just not able to do it in the ways that we're familiar with doing. Our rituals are all changed, to put it one way. So I would say just making sure that you you take the initiative to connect with people and in the ways that you can, and making sure that you stay in touch with people who may be hesitant to call, but that you need to talk to. So being proactive to go out and seek them out is important as well. And to start planning with those folks for a celebration down the road when you can have more people available to do a ritual of remembrance, and some kind of recognition later on, using Facebook and social media to the extent that you can, also to gather those memories and to make those connections with people. So, and I know our clergy are facing that situation a lot, and so having regular conversation with your pastor, if you have one, is I think would be important too.
Thank you very much, Reverend Joyner. If I may impose on you to answer or respond to the next comments. Someone writes, I miss my church. I feel lost. In the past, I could always count on going to my church and getting refreshed. Now I don't even have that. What would you say to that person?
Well, I'd say that I'm with you. This is a really strange season for churches. We're in a high touch business, and we're used to being close to one another and to gathering with one another and to having those regular occasions where we can renew our faith by renewing our connection with each other. So all of the ways that we're used to expressing that, we're having to rethink. And in this season, one of the ways that we love our neighbors is by not getting together. And that's a hard transition to make in our minds, but that is one of the things that we need to do. John Wesley had this saying that one of his first simple rules was do no harm. And one of the ways that we do no harm is by not putting ourselves more at risk. So I think it's very important to express that sadness and to feel that sadness and to say it. It's not something you want to squelch, because I feel that sadness too. But I think remembering our purpose, remembering what the purpose of the church is important. Trying to make connection as you can using the technology that you have and that's available, even if it's just the old technology of the telephone. But also trying to rethink what church can be. And we've said all for many years that the church is not the building. Well, this is our test. We don't have the building at the moment. So how do we be church, and how do we connect with people? How do we love our neighbors in some different ways? And I think finding ways to be of service. I've seen so many examples of people who have done new things to try to help others, whether it's sewing masks for health professionals or being involved in the Shore Delivery Corps as a volunteer. All of these things are ways to continue to express faith through our actions too.
Thank you very much, Reverend Joyner. Let's jump to Minister Karen Downing, Assistant Minister of Jerusalem Baptist Church and the author of today's program. Thank you, Karen Downing, for your suggestion to have this forum today. One person asks, as members of clergy, how have you remained resilient through this pandemic? Can we unmic Reverend Karen Downing, Minister Karen Downing?
Patty, I apologize. It seems like we have lost Minister Downing due to internet technical issues. But just for a technical note, Miss Francis is back online. I apologize. She was having some internet. Reverend Downing was having internet signal issues earlier, and it looks like she dropped off. So I apologize for the technical difficulties.
That's fine. Reverend Joyner, could you help us with that? As members of clergy, how have you remained resilient through this pandemic?
Well, I'm a little worried about my clergy colleagues if they keep dropping off of the call. But how do clergy stay more resilient? Well, I think in the same ways that we encourage church members to be in connection with one another, I think I've really been trying to encourage clergy to be talking to each other. We've had a Zoom morning prayer time once a week with the Methodist clergy on the shore, and have tried to help in the same way that most clergy are trying to help their parishioners to think about taking care of themselves and developing some self-help rituals and continuing to attend to their own faith. We're trying to encourage clergy not to forget themselves when they do that, and to try to take some time off. It's easy. I know for myself that it has gotten busier. Even though we've been at home, it's a busier time than what was before. So it's harder to carve out and to save those spaces. So attending to your physical, mental, and spiritual health is something that's important for all of us. Although I will say too that one of the things that is encouraging about this time is that it does remind you of what's important. I see one of the keys to resilience that you mentioned is remembering your purpose and mission. And I think a lot of us have been challenged to remember why we're doing this and what the mission we're about is. That helps with resilience. Yeah.
Yes. Thank you. And I hate to impose on you, but you are the sole representative right now. And so someone sent in a question earlier, and this is a real planning question. What, if anything, are your congregations planning to do differently in the coming week or two after Governor Northam announced phase 1 of recovering starting May 15th?
Right. We've been spending a lot of time thinking about that, and I've actually been chairing a state or conference-wide committee for most of the state of Virginia to look at going back to in-person worship and what that's going to mean. We have not had in-person worship in our churches since the middle of March. And with the governor's announcement yesterday that we're moving into phase 1, and also a lot of churches are saying, well, what will we do? So we've tried to put together a whole lot of documents and used medical advice as we did that to try to think through it. We're going to do a phased in return to worship as United Methodist. It might start a little later in some places. Northern Virginia, of course, is going to stay in phase 0 for a while, and I see in the paper today that Accomack County has also made that request to the governor. So on the Eastern Shore, it may look a little different, but but we've tried to put together some documents, and we're going to try to have a few pioneer churches start with small gatherings, and really adhere to a strict guidelines as they do that, and hopefully be able to open up more. But we've been looking at everything from, and everything's going to be different because in a way, it's a riskier thing to go back to an enclosed space than it is even to meet somebody on the street or to go shopping. So we meet most of the time in enclosed spaces. So we're going to have to rethink what kind of materials we have in the pews, how we do greeting, how do we maintain physical distancing, how do we do singing? That's going to be a dangerous thing for a while, and I think it's going to be a long time before we get back to regular congregational singing, just because it's a super spreading activity. So a lot of things to think about, and we've got a website. If anybody would like to see the guidelines that we have come up with, we just today launched a website with a handbook for local churches. That's the URL is www.vaumc.org/return for return to church. So that stands for Virginia United Methodist Church, vaumc.org/return.
Thank you. That's a good resource. Thank you very much, Reverend Joyner. I understand that Mozilla has popped back into the conversation, so I'm going to go back to the questions that we had for her. If we can unmute Mozilla Francis, who is our Director of Social Services for Northampton County. And Mozilla, the question is, why are all low-income people, essential people, being laid off? Plant workers, nursing assistants, servers. I mean, I worked 2 jobs just to make ends meet, and I got laid off from both. Mozilla, can you respond to that person and maybe help them?
Well, first of all, thank you, Patty, for having this and allowing me an opportunity to respond to this individual. I think it's so important to just acknowledge how difficult it is for so many people who are struggling day to day, even before COVID-19. They're working 2 jobs. They're wondering why all the people that are low income, it feels like they're the only ones who are being displaced. So first, it's important to know that the community cares. Let's start right there, and that they're not forgotten. You know, right now, if you call a lot of agencies, you'll get a message that says closed to the public. It's important to know just because the agency is closed to the public doesn't mean that they're not working on behalf of the public. And that includes people such as the individual who wrote in and everyone else who's displaced. This is a community and that we are helping each other. It's important to make sure that you get connected with the Virginia Employment Commission. It's important that you reach out to the Department of Social Services. This is a time, community action groups, all of those groups are there. There's a plethora of resources. If you're struggling with paying your utility bills, Members Helping Members is available to assist you for eligible participants. You don't have to know the answers. Reach out to the individuals who can give you support. There's help right now for seniors who may have a difficult time connecting, difficult time because I've been listening to everyone saying how afraid people are. There's so much available, so many people willing, so many people able. Call, make your requests as to what you need for us to support you. And if it's possible, just know that the community is there for you. And as far as the coping, it's very difficult when you feel that you're on an island, that everyone who is low income is being displaced. So one of the coping strategies is to take yourself off the island and know that there's a lot of people who are being displaced right now, but that you're not alone. You are amongst a community of people who do care about you and are able to support you, and that there are resources to help move you through this difficult time.
Thank you, Mosella. And while I have you, if I could get you to respond to this next question. I'm a senior citizen and live alone. I can't get to the pharmacy or the grocery store, and even if I could, I'm too afraid of getting the virus. What would you say to that person?
Well, it's a real fear, and you've been listening to everyone on the panel. The doctors have talked about those persons who are high risk, and certainly our seniors are high risk. But there are groups that are available. For an example, the Eastern Shore Delivery Corps. They are a group that absolutely just came together quickly to meet the needs of the community, and especially for seniors who were vulnerable, who found themselves in this situation, who may need a little extra support, not having to go to the grocery stores. I would encourage them to reach out to this group. Also, we've heard a lot about the churches. We could not function without the support of the faith-based community. Reach out to the faith-based community at this time. So that our seniors and those who are very vulnerable don't have to go out into the community, but still have the necessities they need during this time.
Thank you. And there was a slide up for the Shore Delivery Corps with a phone number and a website. And for all of you who are joining us by telephone and don't have the benefit of the visual, we will put all these resources on Eastern Shore Healthy Communities website, and you can go back and not only view this meeting today, you can also see the questions and the responses to the questions. So I want to turn now to the chat box, and one person asks, as businesses begin to reopen, who will be the best local contact to help understand any expectations, guidelines, restrictions for doing so safely? And I guess, Dr. Richard Williams, if you could respond to that, and if somebody else has more information, hop on in the conversation. Can we unmute Dr. Williams? Okay, we seem to have lost Dr. Williams.
Patty, could I jump in representing
Yes.
the library? And I did type my response in the chat answer box. I suggest you contact the Chamber of Commerce. I know Robbie Marsh has been developing a whole lot of resources. The CDC and OSHA have website pages on preparing your business for reopening. I know they've been proving very helpful for me at the library in planning our reopening. If you want to email me, I put my email in the box, cburton@espl.org, and I can email you those links.
Thank you, Kara. Thank you. That's very helpful. And I'd love, okay. I'll go back to the next question in our feed here. I'm very concerned about outbreaks at the long-term care facilities. I read an article today that 60% of all fatalities in Virginia are related to long-term care facilities. How can the most vulnerable community members be protected on the Eastern Shore? What is being done to improve this situation? And Tom Hollinsworth, Dr. Hollinsworth from Eastern Shore Rural Health, I believe you're the only physician left on the panel. Can you help us with that?
Can someone call Dr. Williams and bring her back on?
Just texted.
Actually,
oh, there we go.
Tom, I was able to rejoin. So
excellent.
Good.
Okay, sorry, just in time for this question. Yeah, well, Tom, I'll be happy to follow your comment.
No,
whichever.
Yeah, go ahead, sir. Thank you.
Okay, so long-term healthcare facilities are a real major vulnerability in our state, and a very great interest and high priority item for the Virginia Department of Health. There's been a long-term care facility task force under the leadership of Dr. Lori Forlano. She's Deputy Commissioner for Population Health. Works directly for Dr. Norm Oliver, our State Health Commissioner. They've been working very hard, and they've developed some guidelines and some procedures and some mitigation measures to help us with this. On the Eastern Shore, over the past week, we've had the assistance of a team, an epidemiology aid team from the Centers for Disease Control that's been with us. They have coordinated to provide us with an infection control officer who's a physician, an infection disease specialist with special training in long-term care facilities, to come out and actually visit our larger facilities and several of our smaller ones. And she's been able to give some great advice on personal protective equipment and practices, housekeeping, sanitation, defensive measures. And I think this week we're in a much better position and posture on the Eastern Shore than we were last week. She was joined by one of our health care associated infection specialists from Richmond, who was able to join her out here in person and has followed her progress every day as she's gone through these facilities. Going forward, I think the expectation is that health departments will kind of assume elements of a newer mission to sort of be boots on the ground, if you will, in primary interface with these with the facilities. It is a specialized skill set to actually go in and take a look at these facilities. It takes about a year to train a fully qualified nurse to be a long-term facility inspector. So we'll graft those skills in an attempt to help them defend their facilities and their patients better against this COVID-19 and future pandemics going forward. So that'll be an additional duty of the health department that we hope to discharge going forward. Thanks.
Thank you. And there are two more questions in the chat box, Dr. Williams, that you could respond to. Do we know or have an estimated percentage of positive cases that report moderate to no symptoms?
That's an excellent question and a difficult one. We know that asymptomatic or minimally symptomatic states in this disease are very, very common. And the percentage of folks that actually have the virus that are asymptomatic or minimally symptomatic, that precise percentage is unknown at this time. I think, but many things about this virus are unknown. I've heard estimates of of asymptomatic folks outnumber symptomatic folks by a factor of 5 to 1, 10 to 1, or even higher. So I think it's very safe to assume that there are many, for every single case of a symptomatic person we test and diagnose, there are many more asymptomatic out there. And some of the point prevalence surveys we've done inside, say, correctional facilities, for instance, with a very small number of symptomatic people, you can have easily 5 to 10 times that number who are asymptomatic if you test everybody in the facility. So excellent question, and more to come as we learn more about that disease.
And one more, I'm sorry, while you're there, Dr. Williams, how available to expect testing to become, given that the Virginia goal is to achieve 10,000 tests per day? Can we expect that will happen, I guess?
I think so, Patty. There's a major push-up at the Virginia Department of Health to obtain testing supplies and to promote large-scale community testing. We held one of those events on the Eastern Shore at the community college last week, where we tested around 1,300 folks in that event. And going forward, we will use teams from the Air National Guard and private contracting teams. The Virginia Department of Health is contracted with companies to come and help us do this testing. And health departments all over the state, health districts all over the state will be setting up these drive-through events. We hope to do them frequently. We hope to do them on large scale. And the current testing technology we have with polymerase chain resistant, the nasopharyngeal swab, in combination with antibody testing, serology as we go forward, that's how we're going to understand the true prevalence of this disease as it develops through this pandemic. And it'll enable our mitigation strategies to be more effective than they are. Thanks.
Thank you, Dr. Williams. The next question, Linda asks, anticipated outcome for this outstanding program today. Thank you, Linda. How will you continue ongoing community-wide multi-generational education programs and activities to promote self-care, resilience, personal responsibility for well-being? There are many people ready to work together in this regard. I will give you my email address. That's tigerpg@evms.edu. Eastern Shore Healthy Communities' purpose is to build well-being and resilience among the community. And we have a particular work group that is the Resilient and Trauma-Informed Communities Work Group. And that is exactly what we are working on, trying to bring educational programs to any organization to try and teach, to get people to have knowledge about trauma and the impact it has on the body, and to try and teach resilience skills, and to create organizations that are trauma-informed. Dr. Hollingsworth's company, Eastern Shore Rural Health, is very interested in becoming a trauma-informed organization, and I know that other groups within Eastern Shore Healthy Communities have made that commitment as well. So thank you for that question. Join us, be a part of that, and you can learn some more. Kitty Croak asks, could Dr. Hollingsworth represent the medical advice on moving to opening up in our current situation? Seems to me that just because we are allowed, it doesn't mean we should. Dr. Hollingsworth, are you available for that question?
Sure. And I know that's the question of the age right now, is how do we start to move back toward some semblance of normal and do it in a safe way and in a responsible way. And I think it's been pretty well laid out that certain things are required for communities to be able to consider this, and that would be to have adequate testing available, to have adequate numbers of people that can do case finding and following cases that are identified to try to isolate the virus and keep it from spreading, but also to make sure that we have the medical resources available in the community, be able to handle a predictable increased number of cases that will require hospitalization. Of course, one of the biggest risks of this in an area with a small, a mighty but small hospital is that if we overwhelm with more cases than we can handle, that not only are we not going to be able to take care of patients that are critically ill with COVID, but also people with strokes and heart attacks and appendicitis and all the other things that are going to still come into the hospital. So it seems to me that we need to have a little bit more information to know what is going on in the community. I do think it's going to need to be an incremental approach, kind of dipping our toe in and probably some retreat and some sort of feeling out what's going to happen in the community. So I know these are very difficult decisions to make. There's certainly important medical decisions, but also I understand that people's livelihoods depend on being open, and I know it's an incredibly complex problem. And but anyway, I'm not sure if Dr. Williams has any more to add.
Dr. Williams?
Yeah, Tom, I think you said it very accurately. I think as we go forward, the community transmission rates in the case numbers on the Eastern Shore are high at this point in time, and relative to much of the rest of the state, the risk is higher for community transmission. And I think elected officials, from what I've heard, are certainly taking that into account, and they're trying to make sure that we maintain social distancing measures and other measures like encouraging wearing of masks and avoiding large groups at this point. So I think those measures will help going forward. In the health department, we'll be watching case numbers and community spread and looking at the data very carefully, and we'll keep elected officials informed of the site picture we see, and they can see the data as well as we can. And we'll hopefully make the best moves going forward to mitigate the risk as best we can as we proceed through this pandemic. But everything well said, Tom. I agree completely.
Thank you both. I have a question that one of our phone callers has texted in. Is there something that the panel can recommend that schools can do now to proactively prepare for children returning to school that may have been traumatized as a result of abuse? Christy, is that something perhaps in your wheelhouse?
Absolutely, it is. I work with the different school counselors in both counties, and they are doing that now. They are preparing. The school teachers have also been spending their time since March 13th trying to figure out how to best keep in touch with, provide support for any of the children of any age who are being traumatized by this. As we all know, all of the seniors, the high school seniors, are grieving, and as Alex mentioned earlier, there's a lot of grief and loss in our everyday lives. The COVID-19 has just enhanced that. So be assured that your school counselors and your community counselors are working together to make sure we can provide as much support as we can for all of the children in the area, as well as the teachers. There was a lot of grief and loss for them as well. So as we all communicate with each other and come together and remember what we can do, we also sometimes have to be strong for everybody else who needs a little help along the way.
Thank you, Christy. We have about 4 more questions, but we have run out of time. And so I wanted to quickly tell the person who has the small group that's working to establish gardening initiatives offering free rototilling to anyone who would like to start a garden. Any resources you can point us to? I would say this is a very close and willing community who's willing to get that word out for you. So just get the word to get it to Eastern Shore Healthy Communities. I'm sure community partners of the Eastern Shore would be willing to get that out, and any other organization. There was a question about, do we have enough PPE? And I want to say that the final question was, it's triggering to see employees not using social distancing and masks. Do you know if that's personal choice? So we will respond to those questions on the website. But right now, that's all the time we have questions for. I hope it was helpful to you. Remember, if we were unable to get your questions, we will still respond in writing on the website. You can just Google Eastern Shore Healthy Communities and find us. A recording of the meeting will be available there as well. Dr. Schaefer, back to you for our leadership reflection and adjournment.
And this over the 4:30 mark, but I'd like to comment on a couple things that I heard, and that is, 1, fear, 2, uncertainty, but what went with those 2 things is a word that I heard, empathy. And if we can give a gift to anyone, we can give them empathy and understand and be empathic for what they are going through. Reverend Joyner gave me something to really think about when he said, by loving our members, it may be by not getting together. By loving our members, we aren't getting together. And one of the things I love about the shore is that in times of crisis, there's innovation. And if you can just put up the Delivery Corps slide real quick, there's a group out there called the Delivery Corps, and what they're doing is providing a service so that you, if you are in a vulnerable population, that you can be able to call a number. It may pop up here momentarily. If not, there is a there is a website. There we go. The Eastern Shore Delivery Corps. If you are someone you know is in a situation where they are vulnerable, these people will go to the grocery store and they will pick up your groceries, not go out and go get them, but we'll need to call ahead and get those and have them ready, and we'll deliver them to you. So the other thing I heard was in the questions, and that is, there are many out there who are ready to work on this. And isn't that the Shore way? People are ready to support each other. Now, as your president of your Eastern Shore Community College, yesterday was our commencement. And do we feel the pain, the loss because of that? Certainly. But the one thing I know for sure, all of our students, by not coming back, are safe. So let me finish by, 1, thanking Patty for the work that you did to put this together. And of course, EVMS, always supportive moving forward. So with that, we had about 50 some odd attendees. 46 right now have stuck with us. So we will tell you where the toilet paper is to the 46 attendees. The rest of the people are out of luck. How about that? So let me finish by saying thank you for taking the time, and stay well.